Without a federal system in place for vaccine administration, each state is doing it a little differently. But some states, like West Virginia, are having better results than others.
We don't have vaccines in a warehouse sitting on a shelf. We've got them in people's arms.
West Virginia is topping the charts with one of the best per capita vaccine rates in the country. It's also near the top of the list of states administering a high rate of doses distributed to them. But how exactly are they doing it? For one, they're focusing on high-risk populations first. The state was the first in the country to complete first-round vaccinations in nursing homes and long-term care facilities. But there was another strategy they used.
Our great National Guard and all of our health officials and everything came up with an idea to basically recruit all the local pharmacies.
Our state is very unusual in that Walgreens and CVS are not nearly as well distributed across all of our state. Half of our pharmacies in West Virginia are independently owned. And we organized over 200 pharmacies in a network that could reach people not only in the population centers that we have, but in the rural communities as well.
That was something that we were not going to be able to have if we had activated the federal pharmacy partnership early on, because we knew that there was at least a 2-week delay with the federal pharmacy partnership.
This worked well initially, but officials soon realized they needed to change course.
We had to make a really big pivot and everything, a pivot away from really going with the Walgreens and the CVS to going with our National Guard.
At least 16 states have activated the National Guard to assist with vaccinations. President Biden plans to deploy both FEMA and the National Guard nationwide to help increase vaccination numbers across the board.
By the end of our first month in office, we will have 100 federally supported centers across the nation that will ultimately vaccinate millions of people.
When it comes to the number of doses distributed, West Virginia has received roughly 200,000 doses. This is significantly less than larger, more populous states like Texas and California, who have received 2 and 3 million doses each, respectively. Fewer doses to divvy out means less of an organizational headache, but West Virginia's vaccination rate is impressive nonetheless. Now that the state is wrapping up their first round of vaccinations, they're ready for more.
So now what we need in West Virginia, we need more vaccines.
Biden's post-inauguration plans include invoking the Defense Production Act to rapidly expand vaccine manufacturing, but organization will remain challenging.
Whether it's an American in West Virginia or California or Pennsylvania, if we can get a shot in the arm, we got a real chance of saving somebody's life.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.